as the world observes World Breastfeeding Week 2026 from the 1st to the 7th of August, health authorities and partners are renewing calls for stronger support to enable mothers to practice early initiation and exclusive breastfeeding. The annual campaign highlights breastfeeding as one of the most effective ways to protect newborns, improve child survival, and support healthy development. More in this report by Babakar Sise, which is narrated by Aissatou Kamara.
Observed from August 1st to 7th every year, World Breastfeeding Week brings together governments, health institutions, communities, and development partners to promote breastfeeding and address barriers that prevent mothers from accessing the support they need. The theme for World Breastfeeding Week 2026 emphasizes creating sustainable systems that protect, promote, and support breastfeeding as a critical foundation for child health and nutrition. According to the World Health Organization and UNICEF, breastfeeding provides babies with essential nutrients, antibodies, and protection against infections during the most vulnerable period of their lives. The two organizations recommend that mothers begin breastfeeding within the first hour after birth and exclusively breastfeed infants for the first 6 months, followed by continued breastfeeding alongside appropriate complementary foods up to 2 years or beyond. Globally, however, millions of children are still not benefiting from exclusive breastfeeding. Recent estimates indicate that about 48% of infants under 6 months worldwide are exclusively breastfed, showing progress in recent years, but still falling short of the global target of at least 70% by 2030. In Africa, breastfeeding rates vary significantly across countries. While the continent has some of the highest rates of breastfeeding initiation, challenges including limited maternity protection, workplace barriers, misinformation, and inadequate support for mothers continue to affect exclusive breastfeeding practices. UNICEF estimates that around 45% of infants in sub-Saharan Africa are exclusively breastfed during the first 6 months of life. In the Gambia, breastfeeding remains an important part of child health and nutrition strategies. Data from national health surveys show that breastfeeding is widely practiced, with many mothers initiating breastfeeding after delivery. According to the Global Nutrition Report, the Gambia is on course to achieve the global target for exclusive breastfeeding, with 53.6% of infants aged 0 to 5 months exclusively breastfed, according to recent data. This figure aligns with the World Health Organization's global nutrition target, which aims for at least 50% of infants to be exclusively breastfed by 2025. The progress reflects efforts by health authorities and partners, but sustaining it will require continued support, especially in workplaces, health facilities, and communities. However, maintaining exclusive breastfeeding for the recommended 6 months remains a challenge, influenced by factors such as early introduction of other foods, return to work, and limited access to breastfeeding counseling. As World Breastfeeding Week 2026 is commemorated, health experts continue to emphasize that breastfeeding goes beyond providing essential nutrition, describing it as a vital investment in a child's growth, development, and long-term health. Aissatou Kamara, QTV News.